Hi, my name is Dr. Daniel Roney, and you have clicked on autism or ADHD or some of the early childhood neurological disorders. What I want you to know right off the bat is Dr. Robert Melillo, author of the book Disconnected Kids. I'm studying with him. I'm working on a certification in early childhood neurological disorders. And Dr. Melillo, as stated in his book Disconnected Kids, has over 1,000 documented corrections to these problems. What I want to tell you, and I don't take this lightly, this statement, is that these problems or diagnoses or neurological disorders can be corrected. Maybe not for everybody, but can be corrected. So it starts with, the understanding starts with the diagnosis. The diagnosis is called functional disconnect syndrome. The treatment for that is something called hemispheric integration therapy. Before I get into those, I also want you to know that in our clinic, what we also want to do is make sure that the child and or person diagnosed with these one of these disorders is tested extensively for whether it could be food sensitivities or autoimmune conditions or what have you. There are things going on in the, I call it the internal environment, systems of the body with some of these diagnosed patients that are contributing to the weakness in the brain. And first and foremost, my objective for sure here is to make sure that we can correct those problems so that when we do work on the brain, there's nothing counteracting our progress. So foods and different immune system compromises, if you will, as well as some other things, can cause the brain to not function right day in and day out, okay, and can cause weaknesses because some of the byproducts cross the blood-brain barrier. I use the example of Jenny McCarthy's son, basically cured him of autism by, among other things, getting him off of gluten. So he had a strong gluten sensitivity. Body was reacting to those proteins in the bloodstream. The byproduct of that attack was causing leaking through the blood-brain barrier, and it was affecting the connectivity in his brain, as an example. Okay, and that's well documented. It's in several of her books, so you can read up on that. Again, clear out the internal environment first. Now let's talk about functional disconnect syndrome. Functional disconnect syndrome is defined generally as one hemisphere of the brain is underconnected, the other hemisphere is overconnected, normal to overconnected. So what will happen is the two sides of the brain here are imbalanced. In order for the brain to communicate properly, or what they call lateralize, the brain has to be balanced so that both hemispheres can communicate together. All right? So functional disconnect syndrome is one hemisphere, and with most conditions, it's a right brain weakness. Things like dyslexia and learning disabilities is typically a left brain weakness, but most others like autism, ADHD, is a right brain disconnect or weakness. Okay? So what will happen is you'll get exaggerated signs and symptoms or characteristics of left brain dominance and under-exaggerated characteristics or weak characteristics of right brain weakness. So what could that mean? Well, just as an example, and there's a ton here, the right brain is your brake pedal. It is your big picture brain. It is also your socialization, where socialization, etc. comes in, some behavior, etc. So one thing that we'll find for sure, especially with hyperactivity or ADHD, if you will, is that there's impulsivity there. The right brain is your brake pedal. Okay, so for you and I that have appropriate responses, we look at things and we go, "Oh, it's not appropriate. I shouldn't do it." Well, a child or a person diagnosed with these early childhood neurological disorders that has a right brain weakness is not going to have that same subconscious, if you will. So their right brain is weak. They think about doing something. They don't even think twice about it. They just react to it. It's impulsive. So the left brain's your gas pedal. If there's no brake pedal or a weak brake pedal there, then the child or the person diagnosed is going to have a very impulsive nature. So impulsivity is one thing that we see with right brain weaknesses. I use a great example. MIT researchers or people that go to MIT, students, they are typically extremely left brain dominant. Okay, so this is the classic genius IQ level, but very bad social skills. Okay, the quote unquote nerds, if you will. So those candidates or students or professors at MIT, very good left brain, very weak right brain. The difference between them and an autistic patient is just another level of disconnect, meaning the right brain and autistic diagnosis might be a little bit weaker, creating a more of an imbalance, if you will, where MIT might have an imbalance, but it's not enough to characterize it autistic, but it's pretty close. So they're savants, their IQ is through the roof, but yet they have no socialization skills. This is like a doctor that has great clinical skills, but is very poor bedside manner. They're left brain dominant. Well, again, with these conditions, what I say is the biggest difference between that diagnosis and not is the amount of disconnect. Okay? So functional disconnect syndrome is the imbalance of one side of the brain. You'll get characteristics that are more developed on one side and less developed on the other. And that's what gives the signs or the symptoms or characteristics of these disorders or diagnoses. So Dr. Melillo clearly states, if you fix the imbalance, then you can fix the problem. Okay? Now, here's one big key. Other therapies out there are very well known to work the entire brain. Now, this is very, very important to understand this. The entire brain does not need to be worked. Only one hemisphere, okay, which is what we call hemispheric integration therapy, only one hemisphere needs to be worked, and certain areas in those hemispheres may need to be worked. It could be certain lobes of the brain. It could be the cerebellum for sure on most of these diagnosed patients. It could be a number of different areas of the brain. The reality is we don't want to work the whole brain, because if we work the whole brain, this is what happens. Both sides get stronger, right? But look, the imbalance stays. What we want to do is work the side that needs to get stronger so balance can be created. That is, if I had to say the biggest difference in this type of therapy versus all others out there, or most others, it's one-sided versus the other. It's a weakness in one of the hemispheres, and the therapy needs to address that hemisphere only, because the objective is to try to balance the brain. Okay? I hope that made sense, because it is a key factor in why Dr. Melillo, in my opinion, has gotten such great results with this care, with hemispheric integration therapy. So in short, hemispheric integration therapy will be able to devise specific exercises, brain exercises, that will allow strengthening to just one side of the brain. Once that happens, or we get closer and closer to equilibrium or balance, a lot of these signs and symptoms and characteristics can go away. In my opinion, you combine that with getting the internal environment right, that won't cause blood-brain barrier crossing, that can create that disconnectivity or contribute to it. Boy, you have a very, very good plan in place in order to get these diagnosed patients better. Okay? So again, there's a DVD that you can order that outlines this in its entirety, a good hour-long DVD that I explain this, and again, right from Dr. Melillo and the classes that I'm taking, the certification I'm taking, and from his book, explains this very, very well. Okay? As always, if you have any questions or concerns, you can always call me via the contact information, or send me an email, and I'll be happy to respond to you in a very timely manner. Okay, good luck, and I wish you the best.